Depression screening. What is depression screening? A depression screening helps find out if a person has depression. Depression is a common, though serious, illness. Everyone feels sad at times, but depression is different than normal sadness or grief. Depression can affect how a person think, feel, and behave. Depression makes it hard to function at home and work. A person may lose interest in activities once he or she had enjoyed it. Some people with depression feel worthless and are at risk of harming themselves. Types of depression. Major depression, which causes persistent feelings of sadness, anger, and/or frustration. Major depression lasts for several weeks or longer. Persistent depressive disorder, which causes depressive symptoms that last 2 years or more. Postpartum depression. Many new mothers feel sad, but postpartum depression causes extreme sadness and anxiety after childbirth. It can make it hard for mothers to care for themselves and/or their babies. Seasonal affective disorder, SAD. This form of depression usually happens in winter when there is less sunlight. Most people with SAD feel better in the spring and summer. Psychotic depression occurs with psychosis, a more serious psychiatric disorder. Psychosis can cause people to lose touch with reality. Bipolar disorder, formerly called manic depression. People with bipolar disorder have alternating episodes of mania, extreme highs or excitement, and depression. Most people with depression feel better after treatment with medicine and/or talk therapy. Use of depression screening. A person may need depression screening if he or she is showing signs of depression. Signs of depression. Loss of interest or pleasure in daily living and/or other activities, anger, frustration, or irritability, sleep problems, fatigue and lack of energy, restlessness, trouble concentrating or making decisions, feelings of guilt or worthlessness, losing or gaining a lot of weight. Most serious sign of depression is thinking about or attempting suicide. A person is instructed to seek help right away if he or she is thinking about suicide. A person can call emergency helpline number, go to local emergency room, call mental health provider or other healthcare provider, reach out to a loved one or close friend, call a suicide hotline. How depression screening is done. Primary care provider may give a physical exam and ask about feelings, mood, sleep habits, and other symptoms. Provider may also order a blood test to find out if a disorder, such as anemia or thyroid disease, may be causing depression. Mental care provider may ask more detailed questions about feelings and behaviors. A person may also be asked to fill out a questionnaire about these issues. After depression screening. If a person is diagnosed with depression, it's important to get treatment as soon as possible. The sooner a person gets treatment, the better chance of recovery. Treatment for depression may take a long time, but most people who get treated eventually feel better. Mental health care provider will recommend a treatment plan based on the type of depression a person has and how serious it is. Types of mental health care providers. Psychiatrist. Psychiatrist, a medical doctor who specializes in mental health. Psychiatrists diagnose and treat mental health disorders. They can also prescribe medicine. Psychologist. Psychologist, a professional trained in psychology. Psychologists generally have doctoral degrees, such as a PhD, Doctor of Philosophy, or a Doctor of Psychology, Doctor of Psychology. But they do not have medical degrees. Psychologists diagnose and treat mental health disorders. They offer one-on-one counseling and/or group therapy sessions. They can't prescribe medicine unless they have a special license. Some psychologists work with providers who can prescribe medicine. Licensed clinical social worker. They have a master's degree in social work with training in mental health. Some have additional degrees and training. They diagnose and provide counseling for a variety of mental health problems. They can't prescribe medicine but can work with providers who can prescribe medicine. Licensed professional counselor. They have a master's degree or some special training. They diagnose and provide counseling for a variety of mental health problems. They can't prescribe medicine but can work with providers who can prescribe. Thanks for watching. Please like, share and subscribe.